Okay, today I'm going to show you how to remove sutures. We are first going to always identify the patient by agency protocol, follow state and federal policies and regulations. We are also going to abide by standard precautions, don gloves, hand hygiene, patient privacy, safety, and good body mechanics. Okay, so the first thing I'm going to do when taking sutures out is I am going to assess the skin for any inflammation, drainage, reddened area. Then, of course, set up all my stuff. So the procedure for sutures is we're going to make sure that we read how many sutures were placed, so then we are taking the right amount out and checking and in contrast with that. I am going to, with my non-dominant hand, I am going to pick up the suture on the side of the where the knotted area is, and I'm going to slightly lift it. Then, with my scissors in my dominant hand, I'm going to place the scissors underneath, and I am going to cut the suture. When removing the suture, I'm going to take it with my forceps on the end of the knot and bring it out towards the side of where the knot is, and I'm going to gently remove off, and then I will continue to do that and take the rest of them out. The next thing I'm going to do, if it is necessary, I'm going to apply the steri strips. I would fit the steri strips according to the size. They would be apart from each other, be 1/8 inches apart from each other, and on the sides would be 1 inch. We would also apply benzoid on the intact skin and let it dry before we apply the sutures, the strips. And we are going to ensure that the strips are not outside the area where we applied the benzoid. Okay, the next one I'm going to show you is a staple remover. So I'm going to obtain a staple remover tool. I am going to also assess the staples and make sure that they are all laying flat and none of them are crooked or and then I will also check documentation to see how many staples were placed beforehand. And then of course I would perform hand hygiene and then we are just going to pull the staple out, and we're going to place it in a small gauze pad. We are always going to be checking the tension of the skin. So if there's no significant pull on that first staple, you can continue pulling the rest of them out. Again, we're going to place all of our staples in a gauze pad. We can apply a dressing if needed, and we want to make sure that our staples are getting placed in a sharps container, and then take our gloves off and wash our hands.